Everybody, I'm Mei-Yu from Taiwan. I'm a medical physicist of diagnostic, and I also a full-time PhD student now. So today I want to share to you about my PhD life before and after part. To be honest, if you ask me, for my research, there is no big difference because I just use my own laptop to do the image analysis, so I can do anything I need to do. It's a good thing. On the other side, there is a big difference for my daily life. I don't need to dressing up every morning like my band, my hair, or my face, so I can save much time for a cup of coffee or for a wonderful breakfast. I know I'm a lucky person during this pandemic. So actually, I only concerned everything get back to normal as soon as possible. Bye.
Hi everyone, I'm Leah. I'm from Malaysia. How has COVID-19 changed my life? Well, I have to wear a mask to come in. It's changed quite drastically actually. I have to take my temperature at the door. I have to, if I go to hospitals, I have to fill a form. And I have to, I have to social distance every time I see people, clients. I have to be very careful with my family. I live with high-risk people, so me going into a hospital can pose a threat to them. I work as an application specialist in the medical physics team, so it requires me to go to hospitals quite often. We cover both government and private hospitals, and in Malaysia, government hospitals have been taking COVID patients, but some private hospitals also had COVID patients. So, yeah.
Hi, this is Ek Hao Ng from Malaysia. We are facing a challenging time now due to COVID-19. All industries are affected, and some of the people are living in fears. In Malaysia, the lockdown period has been started since 18th of March, and all the citizens have to follow movement control order. Our team in Radiation and Oncology Department has been trying our best to ensure the continuity of the services so that the cancer patient can receive their treatment on time. I would like to take this opportunity to thank my families, friends, colleagues, and my mentors, especially Professor Ng, for their continuous support and inspiration. As mentioned by the Director General of the WHO, we have to work in national unity and global solidarity to combat this pandemic. Thank you.
Hello everyone, my name is Tuyền. I'm from Vietnam. I have graduated Master of Medical Physics from University of Malaya, Malaysia. Currently, I'm a lecturer in Nguyễn Tất Thành University, Ho Chi Minh City, Vietnam. During the lockdown, like everyone, I couldn't go to work, so I spent most of the time of the day to read books relating to my research fields, which is diagnostic imaging. At night, I spend time to watch TV with my family, and sometimes we just gather together and talking about the old times, about the memory of the childhood. And in some aspect, I think that was meaningful times because we have more time for our family and have more time for ourselves.
Hello everyone, my name is Thuvip Sangtham. I'm a medical physicist at King Charanport Memorial Hospital, Bangkok, Thailand. Today I would like to share our experience about during the COVID-19 situation. I'm working 50-50% for academic and clinical work as a medical physicist in radiotherapy field. For academic part, We postponed the practical work for all students to November this year and use online teaching for all lecture classes. Our university provides Zoom application in the enterprise level for all lecturers. So it's no time limit and we can teach in the small and big groups of students, like more than 300 students at the same time. In clinic, both radiation oncologists and medical physicists are separated into two groups. We work in different buildings, but in every morning, like 8 to 9 a.m., we have discussed and update our works via Zoom application, and we always communicate through Line group chat during.
Hi guys, my name is Luisa. I am a first year resident and I work in radiotherapy. It has been a really challenging time. It's my first year. I was here maybe 2 weeks, 10 days when it all started, and it's nice to see how much we matter in the healthcare, because medical physicists can't stop working. We are not allowed to stay home. Our patients don't stop the treatment. They have cancer, they cannot do that. It's really challenging to be here, but it's been a difficult time, but really unique to be making part of it. It's been crazy last days. I think I don't see my family in 3 or 4 months, and it's just from...
I'm a professor and researcher in medical physics. I've been working at home since March due to the pandemic. So at the beginning it was very hard to me to organize my time to work and to have discipline. So I was very anxious and I had to set up alarms in my cell phone with time to wake up, to work, to exercise, to relax, and also to go to bed. Now I feel good. I can do it naturally, and I don't need more alarms in my cell phone with time to everything I have to do in my day. I'm preparing my remote class to the next period. I'm also an experimental physics, but by now I'm away from the lab.
Hi everyone, my name is Joanna. I'm a professor at Santo Tomás University here in Colombia. I did my master in physics 4 years ago in Brazil. There I was doing my research in mammography. Now I'm focused on research about innovative teaching techniques and looking for opportunities to take me back to medical physics and do my PhD. Here in Colombia we have been in lockdown since March. Now it is less restrictive, but I have been working from home since then. This situation has brought positive and negative things to my life, but I'm trying to do a routine similar to my routine before lockdown with some changes to improve the quality of my life. First, I'm going to talk about the positive things. Before lockdown, I got up early and prepared everything.
Hello guys, my name is Alejandro, and it's a pleasure for me to be part of this powerful group. Now I am working in a postdoctoral position at the University of Arequipa in Peru, investigating luminescent materials to be applied in radiation dosimetry. I think that this COVID-19 pandemic allowed the people to rethink several issues related to market constructions that at the end they were not important. In my case, I always was working at home or at the university, obviously with restrictions in many activities. Nevertheless, as I said, several of them were market construction without importance. In my opinion, a very important activity is to be past a beautiful Sunday, for instance.
Two. My name is Panjatan and I am from Cambodia, currently working in National Cancer Center Cambodia. Talking about COVID-19, we have only 97 reported cases and our government has put a lot of efforts on this issue. There's no lockdown here, but most of the place was closed and we try to stay home as much as possible and we come to work normally, but we practice the new normal like wash our hands frequently, wearing masks, keep social distancing, and also don't touch meal, just mouth, eye, and nose. I think that's all from my side. And please stay safe together and together fight.
Hi everyone, I am Gunja, the medical visit from Cambodia. So regarding to COVID-19 pandemic, our country is under control. There are 197 patients were diagnosed with COVID-19, but more of the patients were recovered from the disease, and now the situation is getting better. But some restaurants still closed, some like cinema and amusement park or some entertainment place remain closed. But as a medical physicist, I come to work every day, but we practice what the recommendation from the WHO and our government. We practice social distancing, clean our hands, and never touch our mouth, nose, so on. For activities.
Hi all my colleagues, my name is Soy, I come from Vietnam. I am a clinical medical physicist. Now I am working in Hello Oncology Hospital. I must stay at home 1 week because of COVID. I feel very funny at the time because I have a time to drink coffee, listening music, and reading 2 books, 1 book about the economic, 1 book my chicken soup book, and I also analyze the research data and complete 1 paper. However, this paper is in public processing. I will share with you when this paper is public. Thanks for your watching.
Hi, I'm Lin. Experts say lockdown is the world's biggest psychological experiment ever. We could see people around the world feel anxious, mainly because the risk of infections, people fear becoming sick or losing their loved ones, as well as the prospect of financial hardship. Yup, that's what happened in the past 6 months. I personally experienced lockdown and I was forced to quarantine at a designated place for 2 weeks due to work travel. I had to report my health condition to the authority 3 times a day, but I didn't feel the quarantine was like in a prison, rather it was keeping me and everyone safe. During the quarantine, I spent time carrying people through phone calls, asking my friends how are they doing, and I told them that I loved them. I was trying to foster belonging and
So, our days have been very different. I usually teach and now I feel like I'm losing my students. We do not interact the way we should be interacting. Online interaction is not as good as we thought. I cannot see the expression of my students that indicates how they can absorb the materials. So we are all fighting. The students have their own fights, but the world should know that teachers, academics are fighting as well. We cannot then avoid the fact that we need an interaction, direct interaction like that. Even if you are working as a young medical physicist, early career teacher in medical physics like I am. So we are all hoping this pandemic is going to go through